Namaskar. Welcome again to Ask Dr. Gupta. From our previous discussions, we know what is cancer. We also know what leads to this unfortunate situation. Today we shall try to learn when to get alert and how to confirm the presentation of this deadly diagnosis. Detailed discussions about every organ and organ system will be done when we are discussing those organs and organ systems separately. Today we shall focus on symptoms and signs which are common to all cancers. They should alert us whenever they are seen and wherever they are seen. If you find any of these signs in any person around you, that should not make you conclude that the person has cancer. But this should mean that it is necessary to meet a doctor and to get further investigations done. That doctor may or may not be an oncologist. Now we move on and start discussing the most common symptoms. A wound, an ulcer, anywhere in the body which is not healing after adequate treatment for a reasonable time, especially in non-diabetics, should make one suspicious. Cancers of the mouth are mostly seen in the form of non-healing ulcers. Ulcers generally come at a place where quid of tobacco is kept. This reaffirms the multiple trauma theory we discussed in a previous discussion. The smokers can get cancerous lesions on their lips and they can also get them on their palate. Any tooth which is not carious but it becomes loose should make one suspicious and consult a dentist, because it is quite possible that there might be a cancerous lesion sitting in the tooth socket that has made this tooth loose. Now we come to the next symptom, that is bleeding, abnormal bleeding, and the key word here is abnormal. So any normal bleeding after injury or menstrual bleeding should not make one worried. But if there is blood in vomit, if there is blood in cough, if there is blood in stool, then one should immediately get suspicious. Remember, eating spicy food or not having adequate sleep or job stress, they do not lead to blood in sputum. I am mentioning these reasons because people present them as excuses. When I asked them that why did they ignore this symptom, and they said I had non-veg food yesterday, that's why I thought I had blood in sputum. So remember, non-veg food will not cause blood in sputum. One more thing, patients have a tendency to trivialize their symptoms by saying that it was only on one occasion and very small quantity of blood. We have to understand that less blood does not mean less risk. At the same time, if the blood is present in very small quantity, then it will get mixed up, it will get diluted in vomit, in sputum or in stools and will not be noticed. So if we are noticing it, that means the quantity is actually more than slight. Blood in urine might be a first indication of cancer of the urinary system. It can be present in severe infections, can be present in stone disease also, but if there is blood in urine, then it should instigate further investigations. I request the clinicians also that please have a low threshold of suspicion. And in our country, the blood in sputum is most commonly seen in tuberculosis. It is very common, unfortunately, to see a patient taking anti-tubercular treatment for 4-5 months. When he or she doesn't respond to treatment, then investigations are asked for and it comes out to be cancer, and by that time it is advanced. So I would request any clinician, if watching this video, to please be sure that it is actually tuberculosis that you are treating. This confirmation can be done by demonstration of mycobacterium or by demonstration of characteristic features in the cells, in biopsy or in cytology. If there is fresh acidity or there is fresh gas symptoms after taking food, then it may be a first symptom of stomach cancer, particularly in those whose age is more than 45. It is seen that sometimes patients say that I was able to eat everything spicy, I was eating sambar, idli, everything till 6 months back, but now I guess I get acidity once I take them. So this may be a first symptom. Blood in vomit is a symptom of cancer, but more commonly it is seen in alcoholic liver disease. Interestingly, alcoholic liver disease itself, as we discussed last time, is a precursor to the cancer of the liver. It is unfortunate but not uncommon to see patients being given or taking by themselves the treatment for acidity for many months before something as basic as endoscopy is done. At that time, this deadly diagnosis is declared, and it is not that early at that time. Similarly, those patients who have blood in their urine, they are given antibiotics for months before something as basic as an ultrasound is asked for. Forget cystoscopy. The next symptom is lump. Any lump or any nodule, particularly if it is enlarging rapidly, should make one suspicious. This is very significant symptom of breast cancer. It is also a presenting feature of lymphomas, which are the cancerous cells in lymph nodes. One has to remember that painless lumps are actually more dangerous. Lumps are ignored mostly because they are painless. People say that they were painless, they were not causing any problem, so we did not pay any attention. I would repeat what I said in previous discussions, that our elders say that anybody who has a bitter tongue is actually good at heart. Same applies to cancers also, these lumps also. Those lumps which are painless are dangerous, but those which cause pain are either due to pus or they are due to injury. So beware of the painless lumps. Something as simple as jaundice can be the first presenting symptom of cancer of pancreas. Jaundice is also seen in advanced cancers of liver and gallbladder. One presenting feature of cancer of blood cancers is unresolving fever. Fever which is not responding to standard treatment, to good treatment. In that condition, it is possible that it may be because of lymphoma or maybe because of leukemia. Leukemia is a very aggressive cancer that can endanger life unless treated very early by a specialist. Fortunately, leukemia can be diagnosed very easily by a simple peripheral blood smear by any competent pathologist anywhere. Intense itching. This can be present in jaundice, which is caused by cancer of pancreas or cancer of the gallbladder. Without jaundice, itching is seen in lymphomas. I have seen people who have been taking anti-allergic drugs. The dermatologists were clueless that why this person is having unresolving itching, which is not responding to any treatment. They take anti-allergics for a year. Later on, they are diagnosed with lymphoma. Once their lymphoma is cured, their anti-allergics are also stopped. So these very simple symptoms, but remember, none of these symptoms is pathognomonic of cancer. They just make you suspicious and they should instigate further investigations and consultation with the doctor. At the same time, they look ordinary, but they can be first signals of underlying dangerous disease. Delay in diagnosis means delay in treatment and we may not be getting the desired outcome. Do consult a doctor, which may or may not be an oncologist in the first instance. Next, we come to confirmation. Once we are suspicious, then how we confirm that anybody is having this disease. Confirmation is needed before starting treatment of cancer because the surgeries are big, they might be mutilating, the chemotherapy treatment is toxic and it is costly also. We need definite confirmation and answer in yes or no whether the person has cancer or not. The imaging tests, the CT, the MRI, the PET scan, in simple terms we can say that they are shadows and these shadows can misguide. PET scan I would describe a little bit in detail because PET scan sometimes is understood to be a diagnostic test for cancer, which actually it is not. PET scan is a staging investigation which is done after the diagnosis of cancer has been established. We have to remember that PET scan just shows that which part of the body is having the disease that we have diagnosed. So if somebody has tuberculosis, then the tubercular nodules, they look exactly like cancer in PET scan. If somebody had a fracture and that fracture is healing, then it will also show increased uptake in PET scan. So PET scan does not diagnose cancer, it stages cancer. We have tests in blood which are known as tumor markers that tell us about the load of the disease. But these tumor markers are again non-specific. It is possible that the tumor markers go up even when there is no cancer. At the same time, it is also seen that non-secretory tumors are present when the person is suffering from cancers and the tumor marker values come out to be normal. One tumor marker can go up in more than one cancers. So tumor markers are not specific, they cannot diagnose cancer. So what can diagnose cancer? The only diagnostic test for cancer is a pathologist seeing cancer cells under microscope. That cancer cells may be seen in biopsy or in cytology depending on the circumstances. So the final judge, the final authority who will declare that the person has cancer is the pathologist and nobody else. I will repeat here that do not fall for rumors. Delay in sampling of tumor will lead to delay in diagnosis and delay in treatment. The treatment will get delayed and the outcome will not be good. A request to doctors, please avoid empirical treatments. Cancer is curable. Your high index of suspicion can save a good number of lives. Anything not responding to treatment should be further investigated, should make one suspicious. With all these possibilities and an alert mind, We should be able to diagnose cancer, we should be able to catch it before it goes out of hand. If somebody feels that you need more information, you need to discuss with me, then my teleconsultation number is mentioned in description. My email address is also mentioned there. At the end, I wish you all a very happy and healthy life, and those who are under treatment, I wish them a speedy recovery. Get well soon. Dhanyavad.